Hey guys, I wanted to talk to you today about something that I found very difficult to research, which was UPPP and a partial glossectomy. For those that are not sure what that means, it's uvulopalatal-pharyngoplasty. It is the removal of many things inside your mouth, along with part of your tongue. So the reason I needed to do this was almost 10 years of Alzheimer-like syndromes. And just to keep in mind, I'm 51 this month, so it was quite early for me to be having those symptoms. Anything from there was an occasion where I drove on the wrong side of the road. There were a lot of different things about memory and about getting lost in familiar places, and these things would happen on a daily basis. So after neurology test and MRIs and all of that, to figure out why this was going on, my primary care physician suggested a sleep study. So of course I was like, okay, it's not my sleep, it's my brain. So little did I know, after a test, a take-home sleep study test where you're hooked up to different monitors and you have a machine that records everything that's going on, my average events, which is the cessation of breathing, which I'm not sure if it has to last for a certain amount of time. It's either 20 seconds or 40 seconds until your body starts to kick in and breathe on your own. So constantly waking up, gasping for breath. So my average events per hour was 39. We'll just say 40. So with that many times per hour stopping breathing, it starts to affect your brain, your cognition, your just daily activity, and things got very confusing and very difficult throughout each day. So I figured I had to do something about this. So after researching, I found that there was a fairly new, I believe in the last 6 or 7 years, a procedure from a device called Inspire. So I certainly wanted to look into that because the CPAP did not work. I used it for several months on and off. I'm one of the 60% of people that cannot tolerate it, feel like I couldn't breathe. If you're stuffed up, forget about it. So I put that aside and looked at other options. So after visiting an ENT and after going over all my previous medical history and the things I've tried to do to figure out why I've had these cognitive issues, what we did is take a look at the sleep study, and then we did an endoscopy, which is just a tube with a camera goes up your nose. They put you mildly asleep, and they take a look to see what happens while you're sleeping. And I am on the 5% of people that has their entire mouth, soft palate, everything, tongue included, collapse. So Inspire is not going to do anything for that. And I'll explain what Inspire is in a minute here. So once it was determined that no, Inspire is not right for you now, however, we can certainly do the UPPP, the uvulopalatal-pharyngoplasty, along with a partial glossectomy, which is a partial removal of your tongue. And I want to give my entire experience with that up to date. Today is 3 weeks plus 1 day since the surgery. So once we determined that it was everything, we said, hey, let's get all this stuff done in your mouth, and then we'll take a look at it afterwards to see what it's helped, if it's helped, and go forward with the Inspire possibly. The Inspire is a credit card sized device, thicker than that of course. They put it behind your chest muscles, and there's leads that go to your ribs and leads that go to your neck, inside. They attach to your hypoglossal nerves, which controls your tongue. So, and what this device does, with the rhythm of your breathing and the device, and it attaches to the nerves to be able to move that with a small electrical pulse. You're able to have your tongue moved forward as you breathe in. So that's where it helps, and it'll take that 40 events per hour and hopefully drop it well below 10 events, which interprets, or comes out to a lot more sleeping than I've done. And just to keep in mind, I've had this for, unchecked, untreated since the early 80s. So as a young teenager, you sleep over friends' houses and different things. And I remember multiple times being told, hey, we were going to call the ambulance because you kept stop breathing over and over and over. It explains so many different things. If you're snoring so bad, your uvula, swells up and hangs at the bottom of your throat. It takes a day or two to go down, and it just, everything kind of clicked and started to make sense. These unexplained weird events that I've had since the early 80s. And it takes a toll on the brain. It takes a toll on your heart, on the possibility of a stroke. So I knew going into the UPPP partial glossectomy surgery that, I was told it was going to be most likely the most painful thing you've gone through, and I've gone through cancer and a lot of other surgeries. So I figured, pain, I could deal with that. Not a big deal. Let's do it. I want to try and get my life back, trying to get some memory back. I don't know if it's gonna do that stuff, but my memory is fantastic prior to 2010, which is around when I had cancer. So I kind of thought it was, caused by that somehow. So knowing that it's not now, I said, let's go ahead and let's go through with this. So I'm going to give you my experience, and again, it's 3 weeks and a day that I've had the surgery. It was on July 13th. I believe today's August 4th. So day one, going into the hospital, I'm not going to go day by day. I'm going to just give you the large picture of it. I knew it was going to be painful. I knew there was going to be a night or two possibly in the hospital. I spent about 10 days in the hospital. So upon waking up, I believe I woke up as they were taking the tube intubation out of my mouth, and just immediately felt tremendous pain, worst pain I've ever had in my life, in my throat, of course. It looked like a grenade was thrown in there, and everything just kind of all over the place. Everything swollen, red, stitched up, everything. So the surgery itself, I believe, was about an hour and a half, 2 hours. They took out tonsils. They took out the muscles around the tonsils. They took out adenoids. They took out uvula, soft palate. I believe they did more stuff in the back of the throat. They took out a piece of, tongue with maybe, it's hard to see that, maybe kind of a shape like that from the midline of the tongue. Took that out, stitched it together, and it's all just to make room for more air, get rid of the extras, so to speak. So after that first day of the night in the hospital, I knew I was staying for another, because just trying to swallow your saliva was, I don't know how to explain it. Just the most painful possible thing you could do. So to the point where you would, your saliva gathers and you kind of like a chipmunk, put it back without really swallowing it, because once you activate the swallowing, that's where the pain just hits you like Mike Tyson. And you kind of don't want to do anything with your mouth, but you can't help it, obviously. There's no possible way, at least for me, there wasn't, to take pills. So everything had to be crushed up or through an IV. I left after 4 days, just rounds of oxycodone and some other medicines that kind of brought the pain from a 10, though I reported it as a 20 because that's what it felt like. So at the maximum pain I've ever felt, down to maybe 5 or 6 for maybe 45 minutes. And then you would have to wait a couple hours till your next dose. And then you would try to get some Tylenol or crushed up ibuprofen in some pudding, which would take you 30 minutes to put down. I know it's 2 or 3 spoonfuls, but so much incredible pain that you had to just gear your mind up to do it. Hey, you gotta swallow. This is gonna suck, but so you do it, and within 20 minutes or so, the pain starts to subside. So that's how it was for 4 days, 3 nights. I came home after that, and that's when it really, really got bad. So the pain that I felt just kept increasing and increasing and increasing. I knew there was no way I could sustain myself. I literally just would have eventually just died, I guess. I didn't want to swallow. I wasn't drinking any liquids because it was just so incredibly painful. So I would just try to take the, pudding or yogurt with the stuff in there. A lot of moaning, a lot of frustration, and also, so I was taking 5 different medications. 2 of them were most affecting for the surgery and the recovery that I had. One is sertraline, Zoloft, and it, without being able to take those pills, it dramatically increases the pain level for whatever reason. So going from, taking those pills for the last 7 years, 10 years, to just nothing, which you have to do right before the surgery, but there's really no plan of getting that back into your body other than, hey, you should really try taking pills. And it just wasn't an option. So between that and another medicine, lisinopril, I think it's the most popular medicine in the entire country. It's for high blood pressure. My blood pressure throughout, at least the time I was there, and I'm sure while I was at home, was just skyrocketed. So I knew I couldn't sustain myself. I showed up at my doctor's, I think, on a Monday. Since I couldn't talk, it was just too painful. I typed out on my phone, basically it said, I am in extreme agony and pain. I want to know when this is going to end. It was kind of demands, and it was my cry for help demand note. So they read that, of course, and were like, all right, let's get the doctor, let's figure this out. So I was readmitted that day, and I spent the next, I think, 6 days, 7 days, or something in the hospital, again, to rehydrate, to figure out some sort of pattern, or at least consistent process of taking medicine, taking different medicine, trying to figure out everything that was going on. So without the lisinopril during that time, I was probably at 160 something, over 120 something on both arms for blood pressure. So there is a point where enough Sorry, this is kind of gross, but enough blood forms in your mouth and your throat that it forms just, to me, they were ginormous blood clots. So all of a sudden, it didn't really feel like you were going to vomit. It just kind of felt like whatever is in my throat, which is probably a super large goldfish, that's what it felt like. I got to get it out. So with that, it opens up whatever trauma is in the back of the throat, and you can imagine just keeps coming. So especially with the high blood pressure, that was very concerning and eye-opening for me. But they had a plan though, and that event, I had 2 of those events, that could be a precursor to something that happens, the same thing but much worse, where you need to go to emergency surgery. So they keep a trauma kit next to your bed, different IVs, and I forget, I tried to look to see what kind of things they were, but my doctor assured me that, hey, if it happens, here's the plan. We get all this trauma kit going in you, and then we, it's less than 100 feet down the hall into the OR. He's like, don't panic. It's like, it's a rare thing that could happen, but it could happen, a small chance. So, got past that, felt strong enough after whatever, 5 or 6 days, 7 days, I can't remember, and left the hospital, went home, and it's been getting better and better ever since. And again, we're at 22 days from the surgery. There's still pain 24 hours, but it's, a 3. I can sleep now, because prior to that, I think there's about 4 or 5 days where, other than pudding or yogurt, I just couldn't put anything in me. So I lost about 21 pounds. Certainly not overweight. I'm typically around 205, 206. So I've gained a few back. I think I'm close to 190. Again, haven't been this weight probably since after college. But the benefits that I see so far are, I can sleep more than 45 minutes or an hour at a time. When the pain was substantial, was at a 6 or higher all the time, I would physically try to keep myself up. So it was several days where I would just do everything I could to not sleep. But then I would fall asleep, and whatever happens to your mouth while you're asleep, you're woken up because your mouth is on fire. It's so dry. I can't describe it other than sheer agony. You might as well just have somebody with a lighter while doing the COVID test in both nostrils. It's pretty bad. So this chloroseptic sore throat spray helps prior to having to take something, by spoon. At some point I had the lollipops from a compound pharmacy. It's about $21 for 3 of them, just a stick with a little small ball of medicine or whatever, and it's supposed to numb your mouth. However, you would need to put that entire thing inside your mouth and rub all the parts that are so incredibly sore, and then you'd probably just pass out. So they did nothing. They'd be great if it was just lips or my gums or something, perfect, but they did nothing. So at least the spray can get wherever I wanted it to get. And yes, it would hurt immediately, but then it numbs it, and, well, I don't know about numbs it, but it doesn't hurt as much. So that is a godsend. If you do fall asleep, you better be sitting straight up, standing, or I've got like 30 pillows that would prop me up, because you want that above your heart and all that, so less stress on it. Still painful, but much less if you're sitting up. So at this point, I'm able to eat and drink, and I'll tell you, once you start mustering up the courage after about 10 days or so to eat something not liquidy, don't use ketchup because so I'll tell you the benefits in a second, but ketchup, even though it's ketchup. I mean, I'm a guy who would take shots of hot sauces. I love them, especially Frank's hot sauce. It goes on anything chicken, but just ketchup would bring an explosion of pain just from the vinegar, I assume. So avoid. If you're making eggs, look up Chef Ramsay scrambled eggs that are really creamy, because just regular type scrambled eggs, as soft as you try to make them the traditional way, it's going to be harsh. So benefits, right now, I don't know how long it's going to last, but it feels like my taste buds have been rebooted to toddler level. So what I mean by that is I can taste everything. Spices are, they're amplified, like the ketchup thing. I know it's not a spice, but the spices in ketchup, vinegar, and so forth are so strong. If there's 10 different different seasonings, whether it's oregano, onion powder, garlic, whatever, I can taste every single one of them like I've never tasted it before. So that's a plus, because at my age, for whatever reason, the taste buds don't reproduce as fast as they used to, so they become less effective, and hence the hot sauce and lots of salt and bad things for you. With that, I can also smell everything. I go outside and it's anywhere in that block or two, I can smell fresh mulch if it's there. I can smell flowers. I can smell everything that's in the air. And I'm in the Salt Lake Valley, and we get a lot of smoke and stuff like that from wildfires. I can just smell everything. I feel like I have like superpowers for those two things. Everything else I still suck at. But anyway, so those are pluses. I have found myself gasping for breath a few times, not many. One or two nights I've woken up, just like before, because my tongue is still going to collapse. So I still have that issue. The rest of my mouth, forget it. There's nothing there to collapse unless my brain comes out the big hole. That won't be too bad anyway. So that is, those are the benefits. Right now I am sleeping hours at a time, which for me is nuts. I'll fall asleep and wake up, there's still pain, but it's hours later, and I'm like, wow, I was just out for like 3 hours or 4 hours. That's incredible. So I am happy about that. I have, I would say in my mid-30s, I had a big roto-rooter surgery where they cleared out all of my sinuses, fixed a broken septum, just did all kinds of stuff, allergy test, and that was a life changer there. Okay, hardly ever get sick anymore. Never really stuffed up. Pollen doesn't bother me. The smoke that we get here still affects me. I've been in the Salt Lake Valley in Utah for about 11 years now. Prior to that was South Carolina. So that was a life changer. So always had an issue after that though with my left nostril. My right would never have any sort of issues. I would still have it a little bit with my left, and that's gone. There's so much airflow now that it's just, it's kind of like having a brand new nose and everything works great. So, so those are the benefits. And I'm not doing this video to scare anybody out of it. It's more that I felt I was extremely unprepared for what to expect. And I was certainly told about the pain level. It's the worst. I'm going to hate my doctor. Never did. I would have liked to have been prepared better for all of the other things that happen throughout the day. I get that it's going to be extremely painful, but what comes with that? You know, the swallowing, the being prepared for stopping your medicine and a plan to restart it. Are there liquid forms of it? Can I take anything by IV that I was taking before? Can we get it crushed up? Is it an immediate release, or is it a slow extended release where you might not be able to crush it up? So I wish we just had a better plan for that. And most importantly, you start to, at least I did, started to almost panic that I was never going to be able to swallow again, or the pain was never going to go away. You know, you could make it go away for a bit, or at least lessen it for such a short period of time, and then it's back for so long until your next dose of whatever. I wish I was better prepared for, hey, you know what, you're going to be in extreme pain for probably 10, 11, 12 days, maybe 14, before you start to realize that it's not as painful all the time. So because I've never had any sort of injury or anything that was so painful, you know, and lasted more than 5 days, 6 days, you know, I just haven't. I've had some pretty decent surgeries, you know, on all joints, and you know, like I said, the roto-rooter. It was testicular cancer. None of that was anywhere near the longevity and severity of this pain. So be prepared for the pain. Be prepared for a straight, just say 2 weeks of almost unbearable pain at times. And get yourself a plan, know what medicines you're coming off of, and how to take them as quick as possible after the surgery, in the least painful way of taking them. So next step, you know, first of all, my mouth is healing. I know it's been 22 days. My left side still has 3 or 4 areas where I can, you know, the stitches are still there. They're supposed to disappear. But they all have knots, so I can't pull. It's a little too painful, but so anyway, I'm hoping they dissolve and get out of my face. Other than that, it kind of heals in sections, so it's like the stuff that's been done in the front has healed and is just a little raw, and then it gets worse as you go back, and it's still healing all the way back, you know, all the way back in there. So next step is mid-September, so basically 6 weeks from now, we'll do another at-home sleep study, see what the number is, see what that, you know, if that 40 has gone down to an acceptable number. To me, that's pretty much anything under 6 or 7. If it's a 6 or 7 or lower, I'm going to say hold off on the Inspire and the implant, which stays in you for life. Every 10 years they change the battery. I don't know if they had to do that to the $6 million man, but whatever. They could do that to the $2,000 guy. So, and if that's good, I should be good. I'll be tested in 5 years again, because it's still going to come back and get worse. If it's above that number, which I think it might be, just because you know, like I said, I know I'm still gasping for breath at times. We will do the sleep study. We'll do another endoscopy, tube up the nose with the camera, and see exactly what's happening now with the bigger openings. See if it's, you know, if the tongue is still doing that, and then we'll move on. We'll move on to somewhere a month after that or something, and do these Inspire surgery. So yeah, so that's pretty much it. And again, I just wanted to do the video because I couldn't find anything. I saw a few videos where somebody, you know, an adult has their tonsils out and maybe uvula, and you know, it's, you know, I had like everything taken out. I'm surprised I still have my teeth. But I just want others to be able to get details about the experience. I apologize if the video is not the coolest and edited or whatever video. This is my first video I'm ever doing for YouTube. If it was informative, if you have questions, please let me know. Hit like, hit subscribe, and I will answer as many questions that you have as possible, because I think it's important, because I was on the brink of mental breakdown, not knowing if it was ever going to end. So thank you for watching, and I will give you another update probably in September, because nothing's really going to happen until then, and I'll let you know where pain level is. Pray to God it's not there anymore, and you know what's going on with the next sleep study and possibly endoscopy. So thank you again, and you guys are awesome. I appreciate you watching. Thanks.